Hi, everyone. My name is Tanya Sharpe. I'm an associate professor at the Factor-Inwentash Faculty of Social Work here at University of Toronto. And I'm the founder and director for the Center for Research and Innovation for Black Survivors of Homicide Victims, aka the CRIB. Really, it was having the honor and privilege, if you will, of working side by side with Black survivors of homicide victims and being privy to their stories of survivorship. And really just taking that in and listening, but then actually going to look for the research that reflected their voices and their experiences. And at that time, almost 2 decades ago, their voices were not reflected in the research. And so then it became very clear to me that in the absence of understanding their experiences, that we were missing the mark in terms of creating culturally responsive programs and grief and bereavement support resources that could be designed to best support them on their grief journey. And so that's really what led me to this work, to make not only a professional commitment, but a personal commitment to uplift their voices in everything that I do. You know, really, again, the impetus of starting the CRIB was really about there being a significant gap in research, policy, and practice that amplified the unmet needs, if you will, and addressed those needs of Black survivors of homicide victims. And so the goal and the idea behind developing the CRIB was really to build a legacy of culturally responsive research, policy, and practice for and in collaboration with Black survivors of homicide victims throughout our global communities, again, to best position ourselves to support them in their grief journeys. Yeah, the homicide tracker was something that really evolved, again, out of the unmet needs, the absence of race-based data collection, particularly as it pertains to Black survivors of homicide victims. StatsCan still to this day has not collected nor released information relevant to their experiences. And so we at the CRIB sort of took the reins in our hands and began to look at Toronto Police Services data, census data, and neighborhood data, and sort of overlap those 3 data points to be able to tell a story about the disproportionate reality for African Caribbean and Black survivors of homicide victims throughout the GTA, that wherever you go throughout those neighborhoods and where Black people are, they are overwhelmingly experiencing homicide, violence, and victimization. The other thing that the homicide tracker really allowed us to do was to really get individuals to understand what are the root causes behind the homicides occurring predominantly in Black and Brown communities. And it really allowed us to uplift and create a framework that I call social determinants of homicide, where we really begin to consider all of the structural inequities that are inherently structurally violent. Lack of access to equitable educational opportunities, employment opportunities, housing opportunities, and how these structural inequities disproportionately impact Black people, but also are key contributing factors to Black people experiencing homicide at, dare I say, epidemic proportions. And so the homicide tracker, the first of its kind, really allowed us to amplify that narrative that we hear so often from people in predominantly Black communities here in the GTA. You know, I think it really starts with knowledge and awareness. One of the things that I've learned throughout my work is that individuals really need to begin to understand that when someone who is surviving the homicide of a loved one who identifies as Black walks through your door, there are several things at play. I want people to make some assumptions. When they say never assume, I actually want you to do the opposite here. I want people to understand that there is the chronic sort of exposure to homicide, violence, and victimization that's happening. But always in the backdrop is the experience of anti-Black racism that is also traumatic. And these two traumas are constantly working together to really influence whether Black survivors of homicide victims view social workers as hurtful or helpful, organizations as further stigmatizing them, whether social justice will ever be something that they will see in their lifetime. These very lived experiences and perceptions and worldview are always front and center when we engage with Black survivors of homicide victims in the provision of mental health services. I think the other thing that's important for our social work profession to understand is that we should not be doing this work alone. That our approach and engagement should always be interdisciplinary. That the training and culturally responsive resources that our service providers must always have, whether you are in the social work profession, educational setting, law enforcement setting, socio-legal services, medical services, that all of us have a responsibility to work collectively together to help Black survivors of homicide victims cope with this stark reality of homicide, violence, and victimization. We are so grateful and so excited to have received the Black Research Network Ignite Grant Award. And it really will allow us to amplify the results of the Invisible Wounds Project. The Invisible Wounds Project is the first project of its kind dedicated to, again, listening to the voices of Black survivors of homicide victims throughout the GTA to better understand what's hurtful and helpful. What has the impact of homicide been on their physical, mental, and spiritual well-being? And then there's a second component of the project where those same individuals who we conducted focus groups with were able to create stories through a digital platform, a mini documentary, if you will, of their perspectives of the impact of homicide. The Ignite Grant will allow us to do what I think is necessary to really say that we're doing culturally responsive research, to do what I think is our responsibility when we think about research as activism, which is to make sure the community members have access to the data, to make sure that they have an opportunity to hear from the individuals that were participating in this research for the purpose of perhaps amplifying their own programs, to make sure that policymakers are hearing directly from those impacted by homicide about what types of services that they need, to make sure medical professionals and police officers and other stakeholders can be privy to how this devastation has impacted so many Black families and communities, and more so, how we can better position ourselves to help. So again, we are delighted to be able to take this grant funding and to basically be able to feature community viewings of the digital storytelling and actually have panelists participate and engage with community members about the impact of this project on their lives.